percentage of people have a single TTP episode versus those that relapse more than once?
So the largest database that I'm aware of is actually our own report, and it was overall is 34%, slightly higher, 40% in blacks, 26% in whites. So I think a third of patients are destined to relapse at some point. The longer the follow-up, and this was about 25 years of follow-up. So I think that's a pretty good number. But if you've relapsed, it sounds simple to say, but if you relapse once, so episode number 2, you're more likely to get 3, 4, and 5. If you just got it the first time, I think the number is about a third of the time. But it's hard to know when that window ends. The longer you follow, that number might grow just a bit.
Yeah, that's a good point. So we just looked at our pediatric data for the last 20 years. It's important to remember that there's been changes in the treatment, how we treat these patients. We try to do upfront rituximab. So we have seen that our relapse rate was higher if we actually divide them into first 10 years and second 10 years. The relapse rate has gone from about half of them to closer to like 30%, similar to adult ranges. So which kind of speaks to how we've been managing patients with immune TTP the last few years.